All right, good afternoon, and welcome to today's webcast focused on patients, employers, and payers. Are they ready for telehealth? My name is Laura Jean Flagger. Many of you may know me as LJ. I am a senior manager here at DHG Healthcare, and I'm a leader in our Illuminous practice or a piece of our Illuminous solution. Our Illuminous capability set is positioned to assist providers and employers in direct to employer and direct to consumer strategies. It really is our unique approach that has targeted strategies and tools to identify, capture the value of untapped opportunities that help employers and providers increase market penetration and growth and really optimize their solutions in this space. As part of the work we do in this space, we've helped national, regional, and locally based organizations assess and implement things that might be familiar to you, known as narrow network contracts, on-site, near-site clinics, concierge services, telehealth services, and bundled payments. I am really honored to be the moderator for the webcast today. We have just a fantastic presenting faculty, which I look forward to introducing in a few minutes. Before I do that, I'd like to hand it over to John to introduce Jones Day as one of our sponsors for today's webcast. John?
Thank you, LJ. Hopefully everyone can hear me. And just very quickly about Jones Day. First, we're very, very pleased to be able to work on this 7-part telehealth series with Dixon Hughes. We have had a long history of collaboration with Dixon Hughes Goodman and DHG Health, and it's really a pleasure for us to continue to work with you all on this. As some of you may know, Jones Day is one of the largest law firms in the world, and I believe is the largest law firm by number of lawyers in North America. And we have a very vibrant healthcare practice and one of the leading digital health and telehealth practices in the United States. And so we are very excited to be here today, myself, my partner, Lisa Hahn, and look forward to having a really good, engaging discussion with you all. I think that this second slide on Jones Day just gives a sense on just how complicated digital and telehealth can be. And as you can see, the number of legal issues that are involved to really make telehealth work for your organization, there's a really extensive number of issues involved, from corporate practice issues to licensure, data privacy, and HIPAA, the intricacies of reimbursement and coverage, which we're really going to hit today, I know, as well as issues like fraud and abuse. So I think this just shows as a slide how complicated the framework is and all of the things that need to be taken into account.
Thank you, John. It is complex. It is complex, and we're going to do our best to tackle a few of those complex items or topics today. Before we get started, let me tell you who you're going to hear throughout today's conversation. As I mentioned, we have 3 phenomenal panelists that are with you. John Kersner, who you just heard, is a partner at Jones Day with more than 25 years of experience representing health systems and large provider organizations on cutting-edge, reform-driven transactions. John has assisted in the formation and operation of more than 20 clinically integrated networks. He's assisted in the negotiation of shared savings arrangements with payers, as well as hospital quality and efficiency programs and related co-management ventures. He has exceptional experience in the area of payer-provider contracting, including payer financial distress and preference matters. John, thank you so much for being with us today. Lisa Hahn. Lisa is a partner as well at Jones Day and focuses her practice on transactional and regulatory matters for healthcare and insurance clients. Her experience includes formation of insurance companies and managed care plans, payer and provider joint ventures or allowances, negotiation of TPA, PBM, and other vendor agreements, and participation in Medicare Advantage and Medicaid managed care programs. Lisa regularly advises hospitals, physicians, and other providers on strategic alliances, products, and network issues, prompt payment, compliance, audit, and recovery. Wow, Lisa, that is quite a bit. Wow, it's great to have you with us today. Thank you so much. Carrie Officer is an operational vice president of Nemours Center for Health Delivery Innovation at Nemours Children's Health System, where she provides critical leadership for a team that develops digital tools, creates content, and design processes that focuses on making healthcare simpler through effective and efficient communication, innovative care delivery, and frictionless transaction processes, making the consumer experience a top priority. She led the launch of the Telehealth program in 2015, which is now offered in more than 50 plus specialties across the enterprise. Carrie, it's so nice to have you with us today. Carrie, with that introduction, I'd like to hand it over to you just for a quick overview of Nemours.
Sure. Thanks, LJ. It's great to be here and great to be here with all of you. Nemours is a pediatric health system. We're devoted to children's health, providing care, research, and education. We have two freestanding children's hospitals, one in Wilmington, Delaware, that was opened in the 1930s, and then one in Orlando, Florida, that was opened more recently in 2012. We have 80 patient care locations in 5 different states covering primary care, urgent care, and specialty care, and also what I would consider quite a robust telehealth program in pediatrics, really to meet the needs of our patients and families far and wide. So thanks for the introduction, LJ. Look forward to the conversation.
Thank you so much, Carrie. All right, so how are we going to spend our time today? We're going to set the stage with 2 important topics. First, just the telehealth landscape. John, you did a terrific job teeing this up. We're going to look at it from a little bit of the angle of the current pandemic. And then I want to provide a little bit of the experience from an employer perspective. Then as a group, we're really going to dive into 3 key areas. And if you remember what John said, these are complex, but we're going to try to simplify them and share what we're seeing across the national landscape. Then we're going to conclude with a call to action. Hopefully you're going to hear some helpful tips for you and your organization as you wrestle with these things as well. So in regards to telehealth and the landscape in regards to where we are today with this global pandemic, organizations are experiencing environmental forces that are unique in 2 senses. One, they're unprecedented in the sense that we have never experienced many of these types of financial, clinical, and operational struggles. And second, they're broad-reaching, that no provider, system, or organization is immune to these challenges. We have, like most of you on this webinar, kept up with the rapid changes in regulation, confirmed cases, and staggering outcomes of the COVID cases. While there are several forces that are universal and applicable to all of our clients, we are seeing more and more that the magnitude and the timing of the forces vary region by region, state by state, provider by provider. That is not going to be an exception to this conversation. Many of the things that we're going to talk today are going to be the same. These nuances are really causing all of us to prepare differently and focus in these areas differently, deploy different strategies differently. This preparedness and experience is something that we feel is really critical when looking at your response and your approach. And that's why we're going to end today's webcast with a call to action. Just quickly to talk about the employer experience, and I know we're going to spend time thinking about the provider and the consumer. As we think about the employer, employee health insurance is a vital component of an organization's benefit structure that demonstrates a commitment to the company's values, mission, and well-being of its people. The sudden and wide-ranging market changes seen in response to this global health pandemic is creating uncertainty for employers' future healthcare costs, including clear-eyed projections of implications for their organization's current and future economic position. Maybe said more simply, the rising cost of healthcare due to COVID-19 is eroding margins and forcing organizations to consider trade-offs between the workforce and their future growth potential. And you can see that maybe simply if you look in the top right-hand corner, which shows you the scenario analysis of low, medium, and high impact of a sample organization. These projections are in line with CDC guidelines, and so they are pretty consistent with what we are hearing and seeing across the marketplace. All right, let's dive in. So for a majority of the remaining time, I'd like to have a discussion with our panelists, and I'd like it to be very fluid. We've had several conversations leading up to today's webcast, and so we're going to start with this topic of the patient and the consumer, and really the increased utilization. John, I'd like to start with you to get us started. If you could just share what you're seeing from a national perspective in regards to greater access, greater utilization, and greater adoption.
Yeah, sure. That's great. I mean, there's no doubt that before the COVID experience, right, really hit all of us in healthcare. So what I'm saying is before, let's say, March 1st of this year, there is no doubt that telehealth was a coming wave, right? And there's no doubt that there was a great deal of excitement about it for several years, and that there has been a wide range of implementation of telehealth throughout the country. But I think probably most of us on this call would agree that the world really did change in March of this year with regard to telehealth, especially with regard to how patients, how the beneficiaries and the employees who are beneficiaries of employee health plans and their dependents all have viewed telehealth, given what's happened to us as a country because of COVID. With the abandonment of, for a multi-week period across the country of elective procedures in the office, elective office visits, folks still got sick. Folks still needed to talk to their doctor. And as I think probably most of us know, a great vast wave of telehealth has ensued. And I think what we're seeing across the country is an embracing of telehealth. And in so many respects, as you think about what we hear on the news, how there are permanent changes that are going to happen to our country as a result of this experience. One of those that many of us, I think, suspect will be permanent is the embracing of telehealth for an awful lot of conditions by the patient. The patient experience, in other words, I think is going to drive what we as providers or those who represent and counsel providers need to do in the wake of COVID. Patients, I think, will demand and are demanding effective telehealth on a go forward. They don't see the reason to go into a provider's office and sit in a provider's office's waiting room when that same visit can happen via an online video and audio sort of technology. So, I mean, I think to me, and maybe I'll turn it over to others on the panel at this point, but I think to me, I really think we're seeing the patient experience as being a key driver on all of this with regard to how the providers handle things and how the employers are viewing telehealth for their employees.
John, I think this is Carrie with Nemours. I think you make just a spot on point in regards to patient satisfaction. So we have seen tremendous growth and ramp up. We were averaging around 65 visits for telehealth a day prior to COVID. Now we're anywhere between 1,500 to 1,700 visits a day. It has become a key during this period of time to stay connected to our patients, our families, and the patients and families have responded with overwhelming satisfaction, 4.9 out of 5 stars. We hear it again and again in so many comments that having that opportunity to stay connected to their physician, whether it's a primary care or specialty care physician, has been huge. And as we now begin to kind of reopen the doors and get back to, what everybody is referring to as our new normal, we are really challenged with social distancing and how we're going to leverage very key, what I would call premium clinical space, right? It is now really important that we manage the flow of patients and families to keep everyone safe. So moving forward, telehealth is really a key component of our strategy. It is no more a nice to have, a vision of the future. It is the here and it is the now. And so I think, to your point too, patients and families, now that many of them have experienced it, we are going to continue to see that desire moving forward. And I think it kind of bridges over into, self-insured employers, commercial insurance, and even Medicaid, how critical that telehealth is going to be, need to be just care as normal. It doesn't need to be a separate or different benefit. And so that's a really important point. I think that the industry is going to have to grapple with going forward.
Mm-hmm.
Oh,
Lisa,
thank
I
you,
want
Carrie.
to yeah.
Yep.
Mm-hmm.
Yeah. So I think, one of the, I think what John and Carrie spoke about eloquently just now is really that competency level and at the provider side and the readiness that they, in terms of the telehealth capabilities. And obviously, post-COVID-19, we're also looking at much greater consumer demands as well with regard to telehealth services. And plan design is actually one of the most practical and important aspects of really, bring full circle on the telehealth development here. Because we always say follow the money. And if there's no reimbursement, it's very difficult to get a service, what type of service started. So prior to COVID-19, I would say one of the largest barriers to telehealth development and growth is really lack of a reimbursement from the payor side. And so the way to, you can say, how come the payers don't come to the table and provide the benefits and pay for the services? Well, we have to keep in mind that payors, actually, the health plans are accountable to their customers, and which are the policyholders, the employer plans, for example. So they are the guardians of that just say they want to make sure to keep the premiums down, and they can't just like open up the purse string to say that I'm going to go ahead and pay for the telehealth. It has to be basically. So what we're saying in terms of this bullet is really, it is actually a very critical component to incorporate in that plan design, that telehealth offering. Of course, when it comes to plan design, there are a garden variety of ways to embrace the telehealth offerings. And so we're talking about, should this be a covered benefit? Should a telehealth simply be a way of delivering care, that is for which benefit has been provided, that is a covered service? And should this require prior authorization? Or should telehealth be limited to a smaller subset of the healthcare services? And then the other thing I also want to mention is, in today's environment, in the United States at least, I think we may or may not like to think this way, but we have commercial insurance, but much population is covered under some type of social insurance. By that, it could be Medicare Advantage, it could be Medicaid managed care plans. And so it's a one form or another of the social insurance or commercial insurance. And COVID-19 has stimulated and encouraged prompted development of coverage of telehealth services. Some really for the time being, and we're seeing that there could be longevity, as Carrie and John just pointed out, beyond the COVID-19 time. And health plans often follow really the government plans lead when it comes to coverage decisions and design decisions. And so I think we're seeing a lot of great developments that really gravitated toward opening up the telehealth markets, even for the periods post-COVID-19.
Mm-hmm. Thank you, Lisa. Lisa, I want to stay with you as we go to the next topic in regards to payment and coverage parity. I know in our earlier conversations, we talked about inconsistency in terms of understanding and then approach to this topic. Share with us what you're seeing in regards to parity.
Yep, absolutely. And the other side of the coin on plan design is really when it comes to understanding telehealth coverage, we're looking at there are really two big aspects, right? One is really to say, is this a covered service or not? So we call it a coverage issue. And the other one is really, okay, we now established that it is a covered service. Then what about the payment? So on the cover parity side, a couple ways. I mean, basically, we're looking at sometimes the federal law will weigh in, especially during the COVID-19 time. The federal law has stepped in to require coverage parity. That is, if you cover this service in person, and you have to cover this service in a telehealth fashion. And in other words, you cannot discriminate telehealth just because it's being delivered telehealth. That is coverage parity. On the payment parity side is really to say, okay, if the services can be, is it delivered in person with this rate, and if it's clinically appropriate to be delivered in the telehealth way, then it's either the same payment parity, same payment as the in-person payment rate, or is a discount. So what we're seeing in this area, LJ, is really, in the Medicare and Medicaid area, I think the government have stepped in to say, okay, we want payment parity in addition to coverage parity. That is, if it's clinically appropriate to deliver care through telehealth, it got to be paid the same rate as basically in-person visit. However, what's not being spoken about under these numerous emergency measures and the federal mandates really on the Medicare Advantage plan, there is not as clear a guidance as the Medicare fee-for-service program when it comes to payment parity, even though there might be coverage parity, because Medicare Advantage plan is required to offer all Part A, Part B. If it's under the traditional fee-for-service program, it's mandated to be included in Medicare Advantage, but the government falls short of saying Medicare Advantage also needs to cover telehealth following the same parity rules for Medicare and Medicaid, the fee-for-service program. And in the commercial setting, some state laws have stepped in, and some governors have declared emergency measures to require the payment parity, but most really is unspoken when it comes to the payment parity area. And so what we're looking at is really, I do want to share that basically we see a lot of health plans that basically come through during this period of time and stated that during this 90 days or the period where there's a public health emergency period, they're going to provide the payment parity. We're also seeing some payors basically not allowing for full payment to providers. And I think this is really, at this time, I think it is, as you pointed out, LJ, I think especially important for providers to have that payment integrity, because I think providers actually relied upon the source of a reimbursement from health plans to sustain and provide quality services to their members. So I think that's really the payment parity is where we see the biggest gap and disparity among the commercial payers.
Yeah, thank you, Lisa. And before we move to our last topic, Carrie, I just want to give you a chance to react from a provider perspective, what you're experiencing and what you observe patients to be experiencing.
Sure. Yeah, there definitely is some confusion. I mean, I think with all the rule changes, who is covering the copays? Is the patient responsible? Is the insurance company responsible in covering that? And so from our experience, we have incurred a lot of confusion from both the consumer point of view when they come in, does my insurance cover this, all the way to our frontline staff. And so we're in the process right now of developing procedures to have very clear guidelines by payers. It's very complex at this point in time, and definitely in the midst of changing, to be able to collect that copay at the time of scheduling. And then we're also working on developing a digital solution in order to ease that burden and make it a little more sophisticated. But when you look at the consumer side, you look at the insurance cards, and there is no copay stated for telehealth, right? It's either a specialty visit or primary care visit. So I think there's an area of opportunity to improve that clarity for consumers and providers as well.
So Carrie, quick question. This is Elisa here. A quick question is really, so are you seeing, or I understand that copay is being collected at the time of scheduling. Is there any concern that this could be viewed as deposit? And what happens if that just say patients are not able to make the telehealth visit? Is that a refund of that copay? And also, are there any surprise billing issues or any increased administrative burden on your part as a provider on billing and collection issues?
So that was a lot to unpack. No, we do not. We are trying to follow. So if they're having a specialty care visit, we're treating it like an in-person. So we are collecting whatever copay is appropriate, and we're finding that holds true. In addition, yes, there has been additional administrative burden as we are trying to unpack various commercial plans across the 5 states we operate. Medicaid's different in every state as well. So yes, there is a significant amount of burden to try to unpack to do it right the first time. And then we are learning too, the insurance organizations aren't necessarily set up for this claim processing. So we are having to, we're setting it up to bill it via telehealth based on the typical recommendations, but a insurance company may not be set up for telehealth billing and claims processing. So they come back and ask us to resubmit the claims in a different form or fashion, different place of service. So there is a lot of communication happening right now between our managed care, our central billing office, and the insurers to try to get it right.
Team, I'm going to move us to our last topic just due to time. And Carrie, I want to build off of that. And Lisa, thank you so much for that question. I think that just demonstrates how much our provider community is working to mobilize teams and really tackle some of these complex topics. Our last topic is just as complex, the role of licensure in telehealth. Carrie, as a multi-state provider, I know you've done a lot of work. I'd like you to share what you've done so far on this topic.
Yeah, so when the waivers started coming out, both federal and then all the various state waivers that we operate in, we built a cross-functional team. We had legal involved, compliance, operations, our telehealth team, and really developed a federal and state waiver guide. And this is something that we've put out to the organization. Every leader has access to it to get real-time updates, because for about 4 weeks, it was in a constant state of flux. And every state is different when it came to these licensure waivers. Some required you to register with the board. Some required you to get a notarized form with the board. And then some were very limited on the practitioners that could practice across state lines. And so we developed a database and pretty sophisticated dashboard in order to track all of our clinicians. So when these begin to roll back, we'll actually be able to roll it back and move forward with our new processes. And then lastly, we're just looking at our providers who are practicing across those state lines. And now we're in the process of rapidly getting them licensed so they can continue to provide that care.
John, I know you have worked deeply in this space. You have some observations. Maybe can you just add to what you're also seeing nationally, and and I guess in regards to what Carrie has already shared?
Yeah, absolutely. I just want to really quickly say everything that Carrie said is spot on. And imagine this. Nemours is in several states. Many of the telehealth providers are looking at a 50-state plus DC, solution. And so you can imagine the complexity that many of the telehealth, national providers have. And so one thing I'll say is that our task force of telehealth team members at Jones Day has just a deep knowledge and understanding of what's going on sort of on a national basis, and can really help to your organization to the extent that you're in the midst of all of this, and can think about what the multi-state issues are, what your state licensure issues are, and thinking about what's present in terms of these waivers and for the future.
Thank you, John. And so when we think about this, we talked about it as a team. We talked about just the great deal of urgency that is surrounding this topic. The time is to act now, making really that leap from good to great. If you know this book, there's lots of organizations that didn't have that burning platform, that didn't have that urgency, and their organization and growth forward was impacted. We have a set of action steps that together as a team we've decided on. Due to time, I know we're at time, so I'm not going to walk through all of them, but I'd encourage you to take a look at these when we send the deck out after today's webcast. Lastly, I just want to take 1 minute to promote our last 2 webcasts of this season. You'll see there's one on Tuesday and one on Thursday of next week. Really continuing to pick at this or tease out these complex issues in regards to telehealth. Again, I just want to thank our panelists. John, Lisa, Carrie, you have been a pleasure to work with leading up to this webcast, and I just so appreciate the depth of knowledge and intelligence that you brought to today's discussion.